And it's really my privilege and honor to be up in North Louisiana today as part of a week-long effort to announce the formation of the Louisiana Healthcare Education Coalition. And I think, as we all know, this is unprecedented time in healthcare and the changes in healthcare based on the Patient Protection and Affordability Care Act, Obamacare, healthcare reform. And I think the most important aspect of that from a health insurance perspective is that come October 1st, Louisianians are going to be able to go online and purchase and sign up for health care coverage. They'll be able to look and compare multiple health care plans and be able to make decisions for themselves and their families about choosing plans that meet their needs. And for many of us in Louisiana, for maybe 75% of us, we'll find out that we're eligible for a subsidy from the federal government to make the cost of private health insurance within reach. So this is a tremendous time of opportunity in Louisiana, but with this opportunity comes a lot of confusion. The reality we face is that most people in the United States and in Louisiana don't understand how healthcare reform is likely to impact them. The Kaiser Family Foundation said recently that 57% of the people in the United States today don't believe they have enough information to assess the impact of healthcare reform on them personally. And if you look at the uninsured population, it's about 67% of them don't believe they have enough information. So it's not just consumers, though, it's all of the other stakeholders in healthcare. We need to really reach out to brokers and providers, small group businesses, large group businesses, the general public. Anyone in healthcare has a need for information today, and that really is the purpose of the Louisiana Healthcare Education Coalition. Blue Cross is a founding member, but we're really one member. And for a coalition to be effective, we need lots of help. We need lots of people to join us. It's a civic organization, and it's committed to providing unbiased healthcare and wellness information to the people of Louisiana. There's really three main types of information we want to get out. One, some information on the major drivers of healthcare costs. Where is this expensive system need to be better, and how can you as an individual engage the system in a different way? Number two, the critical importance of personal wellness and your own responsibility to taking care of yourself and your family. And then finally, the need for access to quality health care, and that's where health insurance becomes important in the United States. We really want to bring many of Louisiana's diverse communities together to ensure that as many people as possible get access to this information. So we'll be reaching out to brokers and agents, healthcare provider groups, small businesses, faith-based institutions, employers, community leaders, patient advocacy groups, really anybody who's willing to join us in the effort, we want to have them. To date, we're proud to say that we have nearly 40 partners in the coalition. We need this to be several hundred over the next few weeks as we have much work to do in the coming months. I want to pause and just really recognize some of the North Louisiana partners and let you hear from a couple of them, and then I'll come back, give some closing comments, and then take some questions if there are any. The first coalition partner from North Louisiana I'd like to welcome to the podium is Betsy Williams. She's the president of the Alzheimer's Agency of Shreveport and Bossier. Betsy, why don't you come up and share a little bit of your interest in the coalition?
Good morning, everyone. Good morning. As he said, I'm Betsy Williams, or just Betsy, and I am the president of the board of the Alzheimer Agency of Shreveport Bossier. We're an agency that provides education, resources, support groups, and just crisis intervention if need be. I'm really pleased, and so are the other members of my board, to become a part of this great coalition. This is what we need. For us, life is a journey, and with that journey, there's so many changes in healthcare now. I can't remember a time when healthcare was so confusing. And it is so important for us to get that education out there, to let people know there's so many things that they need to know to maneuver. There's going to be so many opportunities and so many choices that it may be just mind-boggling to everyone. I think it's important because life has trials and tribulations. Many people have chronic illness and won't know how or what to do if we don't get the information out there. So I personally and the rest of the Alzheimer Agency of Shreveport Bossier look forward to being a part of this group of people, and I want to call it people, not just a coalition, because it's people who believe in assisting others to have a better quality of life through education and resources. I'm excited, we're excited, and thank you for inviting me to be here.
Thank you, Betsy. I'm not sure I could have been nearly as articulate. That's really heartfelt, and we really appreciate having your agency with us. We also really pleased to welcome Tommy Canterbury, who's the president and CEO of SportsCare, who has graciously agreed to also join the coalition and spend a few minutes speaking to us. Tommy?
Thank you, Doctor. Our business, SportsCare, is my second life. My first life was a coach, a college coach here at Centenary, and then a high school coach prior to that. And had an idea, and I didn't know what ER stood for. So, and I mean that. And just had some ideas on outreach that healthcare is so personal. It's so personal. Nobody likes to, you know, somewhere where you got to go take your clothes off in front of people you don't know is always going to be a little personal. And so, so people are anxious about sports care and need all the education they can get on what to do, who to do, what to do, and how to call. Our company, SportsCare, was designed for outreach marketing. We're not in advertising. There are plenty of people that are great at that, but we are outreach marketing. We gather up the targets for the hospital and the targets then and allows them to, if you will, just insert the message that they want, whether it be seniors or kids or whatever. And we bring the programs and we do that. Well, I mention that to say we are the groundwork. We're down here in the trenches. We see them every day. We deal with tens of thousands of kids across 12 states all year. So our clients are the specialists or the Willis-Knightons or the Baylors or the whoever. But what we have found, what I have found completely always, one thing to be consistent, a thread that runs through everything, and that is the lack of education. And this coalition, this is an exciting thing I thought about it, is it's amazing. And I'm going to give you a little example, true story. We had a coaches clinic here not long ago for 200 coaches, 300 coaches, whatever. They are drivers of business. Our hospitals want to gather those kind of people up. Coach after it came up to me and said, you know what, I've been having some chest pains. And I said, maybe you need to see a cardiologist. He said, no, I need to see a heart doctor. True story. Every profession has its own lingo, its own dialect. And I can talk basketball up here, whatever. You can talk medicine. We can talk whatever. But we assume the rest of the market knows what we're talking about. They don't. They don't. They will call my rep, who is non-clinical, before they'll call a doctor's office because they're anxious. They don't know. I never went to practice coaching and said, boy, can't wait till somebody gets hurt today so I can get them over to the hospital. It's going to be a great thing because I heard about them. It's not. We don't plan for that kind of thing. But if we're not educated, if we don't get this across, good gosh, I've had insurance all my life. For the 680,000 people who don't have insurance in this state, the 30 million in this country who haven't had, you think they're not anxious? They have no idea. I believe that. I'm out there. I'm in the grassroots. I don't think they have a clue. And we're scared to death for all of us in the room who have insurance. What about these folks? So we got a job to do. Heck, I can't figure it out, and I've been in the business 22 years. So I got a feeling they hadn't figured it out. So I think this is a fabulous idea of what you're doing, David. And I think it's going to work out to be a great thing, and I appreciate you letting me put my little 2 cents in. Thank you.
I'm even more excited than I was when I got here today. I think with partners like this, we're going to be successful. Again, I'll just close by saying this is the most sweeping change to healthcare in the United States in 50 years. Think about it. We're taking 18% of the United States economy and re-engineering it literally overnight. 20,000 pages and counting and regulations that mean well, but really need to be translated down to the level of someone on the street who's not engaged the healthcare system in an efficient way in his or her life. And I think that's a huge challenge. So to kind of wrap up, I just want to say anyone here today who wants to be involved, who's not involved. We want your involvement. If you know people who you think need to be involved, please help recruit them. For information about this coalition, our website is LHEC.net. It's a great place to find out information, to see who our current members are as that grows. To get information, we'll be pushing out information as best we can. We hope our partners will help us identify what types of communications need to go out, what their constituents are asking, and what they need. So with that, I'll just say thanks for spending some time with us this morning. We look forward to working with any of you up here in the northern part of the state who are with us. And with that, I'll be happy to accept a few questions if there are any. October is the date where, for most Americans, the full impact of the law starts to be felt. This is when Americans will be able to go online to the health insurance marketplace or exchanges and look at insurance options and select an insurance policy for themselves or their family, and many of those people will for the first time understand whether they get a subsidy from the federal government to help reduce the cost of that insurance. So October 1st is a big date for when this activity starts to take place.
What are the benchmarks in terms of who is eligible for a subsidy to pay for their health insurance?
So it's typically based on income, and people who have an annual income up to about 400% of the federal poverty level, that's almost $85,000 for a family of four potentially, is eligible for some subsidy. Of course, the less money you make, the more the subsidy that you might be eligible for. So there's going to be some confusion. There's a lot of paperwork, and there's work to be done to see where your income triggers a subsidy. And part of the effort of the coalition is really to give information to the people of Louisiana about how this whole thing is going to work.
How did the coalition come about?
The coalition comes out of an effort from Blue Cross as the founding member. In our discussions across the state, through our brokers, through relationships with many employer groups and individuals, we started to become aware that there was a lot of confusion out in the state. And so we thought there was going to be a tremendous need to get information out. We started seeking input from others that we work with, and the coalition was born. And to date, I'm happy to say we already have about 40 members who've joined us in this effort.
We were very pleased that the coalition called the chamber and asked to use our facility for the announcement this morning. Healthcare is extremely important for all of our members. We survey our 1,800 businesses that are members of our chamber, and of the top 12 issues, 4 of those dealt with health care. So it is a very important issue. In any way we can provide quality information to our members, that's what we want to do.
Your reaction to this coalition and everything you've heard here today?
Well, it's a wonderful opportunity because, as they stressed, it's an educational coalition to provide education about health care. There are so many changes occurring that we need independent, quality information out there to help people make good decisions for their health.
Why is your organization getting involved with this coalition?
Because we feel that the most important thing is education right now. People are out there, they don't know their loved ones have Alzheimer's or some kind of dementia, or they have it, and they don't know, they're lost. So education and resources are the most important thing for us right now.
What's your reaction to everything that you've heard and seen here today?
Oh, I'm thrilled. I'm thrilled that we have an organization that sees that we need to get out there and do some grassroots and educate people. Not be political, but educate people and let them know what's going on with, or any resources out there to help them maneuver through this chaos that's happening called, I guess you would call it healthcare.
Tell us, why did you join the coalition?
Well, I'm in the business. I'm in wellness and sports medicine and that type work, and I see every day across 12 states that we work in, our business does, with thousands of folks that access an education regarding health care. It's amazing. It's one of the most important things in our life, of course, but people are very anxious or afraid of how do I access. I saw the billboard, but what do I do? Who do I call? And now, if you throw that in with the huge changes that's going to happen in healthcare, there's no way. And then to top all of that off, you're talking about people that maybe have never had insurance. So we better do some educating.
Are you encouraged by the work of the coalition and what you've heard so far?
Well, I know some of the folks that have worked inside of this, and some of the insurance providers and other people working with it. And I trust these people, I know these people, and I know their heart's in it.
if you look at what's ahead of us when we talk about re-engineering 18% of the United States economy with sweeping legislation unlike anything we've seen in the last 50 years, I think there's a lot of interest. And I think there's a lot of interest on educating constituents of a variety of groups. And so I'm not really surprised. And hopefully this thing will continue to grow.
What do you see as the role of the coalition between now and January 1st?
So the first role of the coalition is to grow. I think part of the program we're doing today is to really try to raise awareness to the effort, to try to bring lots of stakeholder groups to the table to work with us. Then it's all about pushing information out, and it's unbiased information related to all the permutations of healthcare reform, and frankly some information around where the costs are in healthcare and the responsibility individuals have to their own health and to the health of their families.
As a physician yourself, give us your feeling as far as what the patients are going to need to know.
Well, so first thing I think people of Louisiana need to know is that having health insurance is a really key thing to your well-being and your sense of well-being for the future. I think what they need to understand is that having a trusted relationship with a healthcare provider is probably the most important thing you can get in healthcare, and this rule, this effort really brings more people into the formal healthcare environment. That's a good thing.
Are you encouraged by what you've seen and heard so far?
I am. It's really been great. The reception both in New Orleans and Baton Rouge and now so far here up in North Louisiana has been just fantastic. So we're real excited.
If people have questions or like more information about the coalition, what should they do?
Yeah, the best way to do that is just to go on our website. It's LHEC.net. Plenty of information. You can sign up and join the coalition. It's also one of the main ways we'll be pushing information out.